directly onto the software, what we use in the system, and do some live tracking of sugars, and which is where the larger benefit of the CGM system comes in. So this is and I'll show both the systems we use. This is not funded or supported by any of the CGM devices. The conversation talk, that's my disclosure that I'm speaking for CGMs and connected use, and neither for Abbott or Sinocare or Tracky or Dexcom or Medtronic or whoever. Now, connected systems essentially have made life easier. What are connected systems? Where patient's data is being shared in real time with the physician as well as with the patient's other caregiver. So a lot of systems allow that the data will be shared with a spouse or a child or any other caregiver involved, as well as shared with the health care provider. You can see this on your laptop, you can see this on your desktop. Of course, when you're getting into the connected care systems today and using CGMs, the conversation with the patient about what to expect from the CGM, the limitations of CGM is extremely important. As the use of CGM is increasing today, the last thing we want is people not understanding the limitations and then getting into a little bit of misfaith on the system and saying this doesn't work, ye hamesha low dikhata hai, that it's not matching to my glucose meter reading. It will not. There are differences, as Mayur pointed out. There is a lag period, there is a MARD which will show you up to and 10%, and a lot of these devices today will say, like the Libre 2 will say 8.2% MARD, which means MARD is your what's the word? That's your not metric. That's your regulatory requirement for getting any of the glucose monitoring device approved. Less than 15% of variability of MARD, your FDA gives an approval, whether it's for your glucose meter or CGM. They have improved now to 8.2 and 9%, but this is an average, right? So when they say a 9% of MARD, you will have patients where it will go even up to 20% at times. So don't think that it will be only a 9% variability. At times there will be almost a 20% difference between what you see in your plasma glucose or what you see on the interstitial glucose. So coming to the CGM systems, the point I was trying to make when you talk about connected care, let the patient not get the impression that you are monitoring their sugar 24/7. That's not possible. You're not doing that unless we get into an exclusive care with some patients where we say that yes, we are offering that device as that service, that I'll charge you so much and my staff or me will be checking your sugars every day and reporting. You do have a market for that, and there will be some patients who are ready to pay who need that. So that's a different thing. Otherwise, you will tell them that it is connected with you, but you will see the data only when they inform that there was a low or a high, or at the end of 2 weeks when you will go through the data and guide them. So that's again important, because patients should not think that I'm going into a low and getting an alarm and my doctor is all the time monitoring that data. That's probably not possible for most of us. So this is a dashboard that you will see of what's happening. Justice. Okay. Now, let me first get into my EMR and okay, let's start with this patient. Again, one of the aspects that we feel extremely useful is pregnancy. You need tighter control. You are getting patients started on insulin, you want to monitor, and you want to keep them in tight control. So this is an example. Okay, so I'm just trying to show, and the history is seen. This is a 34-year-old lady who's gotten pregnant, and I'll go back to the first time they saw us, which is June, admitted, primey, 2 months of gestation, had bleeding and threatened abortion. So we understand the gravity there, that this is a precious pregnancy at her age. She was getting hypos early in the morning while in the hospital. So she's now put on to Lumjev and Tresiba, a basal bolus regimen that we would want to use in pregnancy. It's still the initial months. The metformin, which was started by the obstetrician, we've continued. And we can see the history here that we've been titrating the insulin. Gradually, the insulin dose has gone up. The A1C was 6.9. Fourth month, and metformin's been knocked off. And it's 6.7 is the last A1C that we can see, which was about a month back, 25th of August. Now, how do you get to that? Of course, 6.7 is not ideal. You would want to get it down. But there's always a question mark of how accurate is HbA1c in pregnancy. And I would say a CGM data and monitoring is far more important than just an HbA1c. Very often you will see an A1C of 6.9, but you will see the sugars remaining in very good tight range. So you don't have to do more. You try and do more, you'll push the patient into hypo. So let me move now to see the CGM data for this patient. I'll have to search.
Recording in progress. Recording stopped.
No, one sec. Oh, sorry. It's. Let me move to another patient's data. Okay, this is another patient who's constantly been in touch again, and we've been able to help. So let me move to Chetna Pandya's CGM. Now this is the CGM. So again, let's say this is the Sinocare system, and I said I'll show you examples of both on Sinocare and Libre systems. So the dashboard at your clinic is going to, in the Sinocare system, show you the different patients which are using it and what their current sugars are. So this is the reports which we are seeing currently. Right now, you make changes in the medicine. You want to see how to help the patient within a few days itself. Now, for example, I move to checking Sunil's CGM. This guy is having cirrhosis, CKD, extremely worried of what's happening ahead, an affording individual, and prefers to use CGM regularly and wants to connect every week. And we are okay to provide that hand holding and do the modification of medications. So this is the data, as you can see right now. When we say connected system, we're seeing the data as of now. This is 122, about half an hour, 1 hour back. We move to yesterday and you will see the data, right? Now, the advantage here is that if there is an issue, the sugars are spiking too high or starts going low, whether it's somebody with pregnancy, cirrhosis, CKD, type 2, you are able to guide and see them. So which is where the role of connected care is coming in. The other role of connected care is today for management of diabetes, does the patient have to come to your clinic every 15 days or a month? So a lot of ecosystem today is changing where they may see you physically probably just once a year to get all the checkup and screening done. The rest of the time, they are okay to do a tele consult with you. Suresh will be sitting on the beach at Goa with his laptop and then guiding the patient about what has to be done. And which is good enough. In diabetes, largely you will be seeing the data. So what do you see here? And this is what I wanted to show. So this is your daily tracing. You will get into the glucose reports. And you can, of course, download the AGP. Again, a myth that AGP is not only for 7 days or 14 days. AGP is basically a software which is compressing the data. Now, if the data provided is for last 30 days, it will compress the 30-day data and show you an AGP. If it is for 90 days, it will compress and show you for 90 days. So this is the CGM data. Is he doing okay? I'm asking you all, is this patient doing okay? Yes. Right? Now, this AGP is for now. You can, of course, see all the previous ones also. Now, what they have also done, and the software is also evolved. So it's good that the companies are also kept on their toes and they evolve. Something new that they have introduced is a glucose statistics report. So those of you who are using this system can actually just take a printout if you want and the patient comes physically, and in this glucose statistics report, you are getting everything, percentage time used, GMI, as Mayur explained, because the earlier term was estimated A1C was misleading. GMI stands for glucose management indicator. It's something which is telling an approximate of what your A1C is going to be like. It's not necessary that the patient's A1C will be similar. So that's why the name was changed. So this report tells you about hypoglycemia and other things, and of course Harsh is going to take the entire aspect on TBR. So this is the connected system. Let me see if I get any of the other names here to show you. So this again is the system for LibreView, and whether you're using the 1 or the 2, your dashboard is the same and it will show you the same aspect. His name is entered as something different. Right? So let's get into, this is again a type 1 individual. So while I'm downloading that data, in the next 2 minutes, let me try and get the basic history of this patient. Okay, so again, somebody who's on a pump, right? Now this is not the AID system. This lady can't afford the 780G, so she's using the earlier pump. And a lot of Medtronic pump users prefer to actually use the Libre CGM because it's more convenient, doesn't require calibration, etc. So she's been using the earlier pump. As you can see, these are the different basal rates adjusted like we used to do in the old pump. The automatic systems, everything gets automated. You don't have to give them advice, and she's taking 4 boluses a day. Now, while she's doing this, it's also important as she's pregnant to do that hand holding through connected care and guide. So which is where we get into her CGM. Now, is she doing well? Is she doing well? She's pregnant, right? She's doing terrible, and she's doing terrible on the pump. So again, for those who thought that getting onto the pump is like the holy grail, no. In fact, the earlier pumps, I think, were all rubbish. I don't know how we used it, and we were also fooled in thinking that it was fine. Suresh has sold the maximum ones, but it's only the automated ones which actually changed life. The old pumps were based on the belief that patient's basal rate is same. So you don't change the basal rate, you're only asking them to change the bolus. I'm digressing from my topic, but I'll still speak my mind. The basal rate for everyone with diabetes also changes. Your requirement for basal insulin changes. It is never static. And hence the old pumps never really help the patients. It's only the current automated pumps where CGM data makes the pumps adjust based on the approved algorithms that you get a flatter line of sugars. So here again, this is her data. It's terrible. But let's go back and see what was happening earlier for her. So this is her current report. There would be earlier data reports also. Right? This is what her earlier sugars were like. She was getting hypos. This is her August data. And here again, the difference and advantage of the Libre for pregnancy. So for pregnancy, I would largely do not get ambitious, stick to the Libre system. That is the most accurate. You have the other systems, the Sinocare, Trachees. Well, a little bit still not great on accuracy, will have its own limitations. And in pregnancy, the advantage again of the Libre system is it's allowing you to do the 63 to 140. So Mayur showed you that the recommended TIR range is 63 to 140 on the in pregnancy. So the other systems are still not allowing you to change. If it will still show you from 70 upwards. So if you want to get the idea right, for pregnancy, if you are getting a 70% between 70 to 180, no big deal. You have to see what is staying between 63 and 140, and which is what the Libre system is allowing you to see. So this lady clearly, in spite of being on the pump, didn't do well. Fortunately, she delivered 2 weeks back and she and the baby are doing fine, but things could have gone either ways. So today, connected care systems for live tracking or for patients coming to you, getting their drug changed, be it insulin, be it start of a once weekly GLP, GIP, all of this requires some handholding and change in medicines. Today, when you are starting the Wegovys and Munjaros in patients, a lot of them require their insulin to be reduced, their sulfonylurea to be reduced. And that is where, again, CGM makes life easier. So let me stop here. And again, thank you for the interest in CGM. We'll now move to looking at the time below range and then taking questions if time permits. Thank you.
Thank you, Manoj. Thank you for
My original